Hello, my name is Sarah Ayub, and today I will be talking about tube feeding. I will discuss the reasons that a child may need a feeding tube and three different types of feeding tubes, which include gastrostomy, nasogastric, and jejunostomy tubes. I will also talk about the impact that having a feeding tube has on a child, the role of the child's teacher, and name some resources for information on tube feeding. First, let's look at some of the reasons that a child may need to have a feeding tube. When children are unable to take in enough food and liquid by mouth, being fed by a tube ensures that they receive adequate nutrition. One reason could be that the child has a swallowing disorder, preventing him or her from safely being able to swallow food or liquids. When a child is unable to swallow properly, there are many complications that could occur, such as aspiration, gagging, and vomiting. Another reason could be that they have a sensory defensiveness, where the feeling of food in their mouth sends them into a fight or flight response, making eating very challenging. Now let's look at three different types of feeding tubes. The first one I will discuss is a gastrostomy tube, also known as a G-tube. A gastrostomy tube is the most common type of feeding tube. It is inserted directly through the abdominal wall and into the stomach. The procedure can be done surgically or endoscopically. There are two different types of gastrostomy tubes. The first type is a long tube, also known as a PEG tube. PEG tubes are typically the initial type of tube used after the surgery for the first 8 to 12 weeks. The second type of gastrostomy tube is a low-profile tube, also known as a button. Some buttons are held in place by a small, water-filled balloon and can be replaced at home. They need to be replaced every 3 months. Non-balloon buttons are harder to be pulled out, but they can only be replaced by a doctor. They need to be replaced every 6 months to a year. Another type of feeding tube is a nasogastric tube, also known as an NG tube. A nasogastric tube is a thin, soft, bendable tube that is placed in the nose and goes down the esophagus and into the stomach. This is a non-surgical procedure, and parents can place this tube after being taught by a medical professional. Nasogastric tubes are typically placed on a temporary basis and need to be replaced every 3 days to 4 weeks depending on the type of tube used. Nasal tubes can cause congestion, and if the child has any problems with reflux, gagging, or oral aversions, this type of tube can make them worse. It is common for children to pull the tube out, so it is a good idea to have a replacement plan in place. Taping the tube to the child's face helps to prevent this. The third type of tube that I will discuss today is a jejunostomy tube, also known as a J-tube. A jejunostomy tube is inserted directly through the abdomen and into the midsection of the small intestines. This type of tube is necessary if a GJ or gastrojejunal tube is not an option or will not stay in place. The procedure can be done surgically or endoscopically. Similar to a gastrostomy tube, a jejunostomy tube can either be a long tube or a low-profile tube. In most cases, these tubes will need to be replaced by radiology to ensure proper placement in the intestines. The opening, or stoma, may leak more often, which can cause irritation. Continuous feeding is needed with this type of tube. The need for a feeding tube can have an impact on a child's education. It may be necessary for the child to miss school due to the procedure or if any complications arise. If a child requires tube feeding during the school day, it must be written into the child's IEP or 504 plan in detail. Typically, schools require a written note or prescription from the child's doctor indicating the need for tube feeding while at school and detailed instructions for their tube feeding. It is the teacher's and paraprofessionals' role to assist the student with their tube feeding if it is required during the school day. They will receive training on the proper procedures for the specific type of feeding tube the child has. The parents will be required to complete paperwork indicating the student's specific feeding regimen. There are many wonderful resources for information on tube feeding, including the Feeding Tube Awareness Foundation, Complex Child, and Tubey Friends. The Tube Feeding Awareness Foundation also offers some of their educational materials in Spanish, and there are also resources for alternatives to tube feeding, including notube.com. Thank you for watching!